Morning. Let me just say good morning to everyone, or good afternoon, or good evening, depending on where you are joining us from. We are just seeing some colleagues joining now, but I think that we need to start and we can finalize that process of making sure that everyone is on board. But it's a very good morning from Addis Ababa and a warm welcome to this press briefing that comes to you from the Africa Centers for Disease Control and Prevention. Now, the program aims to provide information and updates on the public health issues on the continent. We are still dealing with the COVID-19 pandemic, but on top of that, we have other emergency situations that have come up. And to give us a summary of all those situations and what is being done to mitigate the situation, we are joined as usual by the Acting Director of the Africa CDC, and he is Dr. Ahmed Ogwell, and I will be bringing him on board very shortly. But before I do that, I want to just tell you the WhatsApp number that you can use today for your questions, because today we have a different number, and that number is plus 251 93 569 2609. Let me give you that number again. It is plus 251 93 569 2609. But of course, you can still continue to come through on our question and answer section, but also through the live link so that you can ask your questions yourselves. So we are going to be using the usual format where Dr. Ogwell is going to give us the summary, and then we will come to that question and answer section. So let me now hand over to Dr. Ogwell, who is on standby for his rundown of the public health issues on the continent currently. Ahmed, it's over to you.
Thank you. Thank you very much, Wayne, and good morning, good afternoon, good evening, colleagues, wherever you're joining from. This press briefing today is covering, and we apologize, last week we could not be able to have our press briefing, but it covers the last 2 weeks before that we have not had a session with you. I'll start with COVID on the continent, and let me hasten to add that the COVID virus is still being transmitted here on the continent. Our vaccination rate is still low, and therefore it still remains a significant risk for the continent of Africa. So as of today, the 15th of September 2022, we have documented just over 12 million cases, and this accounts for 3% of the total cases that have been reported globally. We have documented 11.4 million recoveries, and this translates to 95% of the total number of cases that have been reported on the continent. Unfortunately, we have also documented 255,699 deaths over the period that the pandemic has been with us, which gives us a cumulative case fatality rate of 2.1%. And these deaths account for 4.1% of the total number of deaths due to COVID as reported globally. The following 5 countries account for 60% of all the cases we have documented on the continent to date. South Africa with 33%, Morocco with 10%, Tunisia with 9%, and Egypt and Libya each with 4% of the total number of cases reported here in Africa. This week, 41 of our countries are reporting a case fatality rate that is higher than the global average of 1.1%. 2 countries still remain reporting a case fatality rate that is higher than 5%, and that is Somalia and Sudan. When we look at the waves, 27 of our countries have experienced a 5th wave. 5 countries have experienced a 6th wave, and there is no additional country that is experiencing a 6th wave, and the 5 countries remain Algeria, Burundi, Kenya, Mauritius, and Tunisia. When we look at the situation of variants of concern, there is no change from the last time that we were here. The variants of concern remain the same ones that we had last week. And therefore, when we look at the sublineages, we see that Omicron BA4 sublineage, Zimbabwe is reporting a new case there. When we look at Omicron BA5 sublineage, 2 countries are reporting this recently, and that is Zimbabwe and Guinea. While when we look at BA275 sublineage, Mauritius is the new country that is reporting this particular sublineage. You will recall that Africa CDC has expanded the network of facilities across Africa that are actively doing surveillance for all these variants and sublineages, so that we have a clearer understanding of what may be driving infection across the continent. When we look at trends, today we are looking at week 36, which is the 5th to the 11th of September, and we are comparing it with the previous week, which is week 35, that is 29th to 4th of September. For new cases of COVID-19 during this period, a total of 5,828 cases have been reported on the continent, which gives us a 14% decrease from week 35. The highest proportions of these new cases during AP week 36 are seen from the southern region with 37%, while the other regions are represented as follows: Western region, 31%, Northern, 24%, Eastern region, 6%, and Central region, 2% of the new cases during AP week 36. In terms of representation by country, those that are reporting the highest numbers during this period are South Africa with 1,593, Tunisia 962, Nigeria 603, Mali with 582, and Zambia with 130. Looking at the incidence per million population during this week, the following 5 countries are reporting the highest average numbers. Seychelles, 135 cases per million population, Tunisia, 11, Cabo Verde, 4, Mali, 4, and South Africa, 4. During this same week, 36, the number of new deaths reported is 49, and it is a 10% increase from the previous week, AP week 35. When we look at the 4-week period, that is 15th of August to 11th of September, the trends we see are as follows. New cases, there's been a 20% average decrease during this period in Africa. And when we break it down by region, this is the situation. 8% increase in Western Africa, 47% decrease in Central, 40% decrease in Eastern, 23% decrease in Northern, 5% decrease in the Southern Africa region. When we break down over this 4-week period by the most populous countries, this is what we see. The DRC showed a 25% increase. Nigeria, a 25% increase. South Africa, a 6% increase. Ethiopia, 18% decrease, while Kenya showed a 4% decrease, and there was no change in Egypt. During this same period, when we look at the number of new deaths, we see an overall 14% average decrease in new deaths on the continent. By region, over the 4-week period, we see 43% increase in the Western region, 16% increase in the Northern region, 25% decrease in the Southern region, while Central and Eastern regions did not show any change. When we look at the breakdown by the most populous countries over this period, we see Nigeria with 100% average decrease in the number of new deaths over the 4-week period. Kenya, 100% average decrease. Ethiopia, as well, 100% average decrease, while South Africa documented a 56% average decrease as a result of new cases of COVID-19. Egypt and the DRC, there was no documented change. When we look at testing across the continent, to date, we have over 122 million COVID tests being done on the continent, and over 137,397 new tests were reported for the EPI week 36. This is a 33% decrease from the previous week, when we had over 205,000 tests being reported done on the continent. For this week, for this EPI week 36, the positivity rate is 4%, while the test per case ratio is 26, which is an increase by 29% in the positivity rate and a decrease by 22% in the test per case ratio. No member state is reporting a test positivity rate that is higher than 12% during this EPI week 36. When we look at vaccinations, as of the 13th of September 2022, the total number of vaccine doses that have been supplied to the continent of Africa is 950 million. And these have gone to 54 of our member states. The number of doses administered is 687 million doses, which gives us a 72% consumption rate of the supply that we have received. Coverage, however, still remains at 22.2% of the total population that has been fully vaccinated, with a 2.7% coverage for booster doses. When we look at the top 10 Africa Union member states that are reporting full vaccination, the situation is as follows. Seychelles, 81.5%, Mauritius, 76.6%, Rwanda, 65.4%, and this is an increase from the last report. Morocco, 61.9%, Botswana, 61.7%, Liberia, 55.9%, again, another increase from the last report. Cape Verde, 55.2%, Tunisia, 52.8%, Sao Tome and Principe, 45.4%, and that is another increase from last time, and Mozambique with 44.4%. So when we look at the situation of the expiry of vaccines on the continent, we see that as of the 7th of September, 16.8 million doses of vaccines that had been delivered have expired. This is a 1.8% of all the doses that we've received. And this is as a result of three essential things. One is slow vaccination on the continent. Second is short expiry vaccines being donated to Africa. And a third is the lack of appropriate longer-term storage facilities for these vaccines. Let me now move to an update of the other public health threats on the continent. To date, today we have 7 different outbreaks apart from COVID, and I'll share with you all 7. The first is monkeypox. And with monkeypox, we have documented 1 new case of 1 additional African country, and that is Egypt. And this is a confirmed case by laboratory testing, which presents us with the following summary that since the last briefing, 1,118 new cases have been documented on the continent, which include 76 confirmed and 1,042 suspected, with 20 new deaths due to monkeypox. This results in a case fatality rate of 2.4% over this epiweek 36. And these have been reported from Benin, Congo, the DRC, Egypt, Ghana, Liberia, and Nigeria. These numbers represent a 50% increase in the number of new confirmed cases compared to the previous week. This means that for us on the continent of Africa, the multi-country monkeypox outbreak continues to persist. Cumulatively, 4,667 cases, including 559 confirmed cases and 4,108 suspected cases, have been reported on the continent of Africa. And unfortunately, 127 deaths have also been documented, giving us a case fatality rate of 2.8% across the 11 Africa Union member states with a reporting period of 2022. As Africa CDC, we continue to support our member states with capacity building for laboratory testing, test kits and reagents, so that we have as many of the cases being laboratory confirmed as possible. And also we continue to negotiate for vaccines for particularly our frontline healthcare workers and the affected communities. The second outbreak is Rift Valley fever, and this is in Mauritania. On the 29th of August of this year, the Mauritanian Ministry of Health did report this outbreak of Rift Valley amongst humans and concurrently with animals as well. Cumulatively, 28 human cases, including 4 confirmed and 24 suspected, with 2 deaths, giving us a case fatality rate of 7%, has been reported in Mauritania. For animals, a total of 41 cases have been confirmed. 21 deaths have resulted from this outbreak in 4 regions of the country. We are working with the Mauritanian government, particularly the ministries of livestock and that of health, to contain this particular outbreak in Mauritania. The third outbreak is the Crimean Congo hemorrhagic fever, again in Mauritania. Since the last brief, 36 new cases, including 2 confirmed and 34 suspected, with 1 death, giving us a case fatality rate of 5.3%, have been reported from Mauritania and Senegal. Mauritania has reported 34 cases, and Senegal has confirmed 1 case and 1 new death. Cumulatively, for Crimean Congo hemorrhagic fever, we have documented 38 cases, including 2 that were confirmed and 34 that are suspected, with 1 death, giving us a case fatality rate of 2.6%. In response, the ministries responsible for livestock in both countries have been conducting public awareness campaigns within the affected communities, as well as increasing the preparedness of the facilities that are serving these communities, so that cases can be able to be identified and treated early. The 4th outbreak is the multi-country Lassa fever outbreak, where we've seen that since the last briefing, 15, that is 15 new confirmed cases and 155 suspected cases have been reported. No deaths have been reported, and only 1 country reported these cases during this last week, and that is Nigeria. This is a 12% decrease in the number of new cases compared to the last briefing. Cumulatively, for Lassa fever, we have documented for this year 7,613 cases, including 970 that were confirmed and 6,643 suspected, with 194 deaths, giving us a case fatality rate of 2.6% during this year. 7 member states have been affected by Lassa fever across the year, and in response, Africa CDC and other partners are conducting multi-sectoral preparedness and response activities across the 7 affected countries. The 5th outbreak is a multi-country cholera outbreak. This is affecting 13 of our member states so far, and since the last briefing, 699 confirmed and 3 suspected cases, with 12 new deaths, giving a case fatality rate of 1.2%, have been reported from 2 member states, and that is Malawi and Niger. Cumulatively, though, the 13 countries have reported 40,055 cases, including 4,783 confirmed and 35,272 cases being suspected, with 602 deaths, giving us a case fatality rate for this cholera outbreak of 1.4% across the 13 member states of the African Union. In response, we are working with all the affected countries to develop risk communication strategies, to implement community outreach, and also to provide the necessary tools for not just our health workers, but also for members of the public to be able to contain the spread of this cholera outbreak. The 6th is a multi-country measles outbreak. Since the last briefing, 2,864 new cases with 50 new deaths have been reported, giving a case fatality rate of 1.7% across 6 of our member states. This is a 38% decrease in the number of new cases compared to the last update. Cameroon, Senegal, Somalia, Tanzania, and Zimbabwe are reporting cases of new cases of this measles outbreak. Cumulatively, from the beginning of the year, we have documented 181,329 cases, including 29,193 which are confirmed and 152,140 which are suspected. 2,268 deaths have been confirmed, giving a case fatality rate of 1.2%. The number of countries affected so far is 24, and we are working with all of them to limit the area of coverage of cholera, the outbreak, and also to limit the numbers of those who are suffering and deaths from this outbreak. And finally is rabies in South Africa. This is the 7th outbreak on the continent. Since the last brief, the South African authorities have reported 2 new confirmed cases, 1 probable case, and 3 deaths as a result of rabies, which gives a case fatality rate of 100%. This is the same number of new cases and deaths as was at the last update, so there has been no change higher or lower. Cumulatively, though, a total of 15 cases, including 10 confirmed, 5 probable cases with 15 deaths were reported from South Africa since February of 2022. The Ministry of Health continues to provide rabies vaccines and human rabies vaccines, as well as dog inoculation of the dog, so as to limit the possibility of rabies spreading in the community. We are providing them with the remote support at this stage. Now, to finally, other announcements, I would like to share 2. One is on 9th and 10th of September, the Southern Africa region of the Africa Union, all the 10 member states, the ministers met in Livingstone in Zambia, hosted by the government of Zambia, and represented in the person of the Honorable Minister of Zambia, of Health of the Republic of Zambia, where the call to action that was made by our heads of states in July during the Executive Council and the Media Coordination meeting was being put into action by the health ministers. They agreed, amongst other things, to establish a technical working group in Africa, in the region, facilitated by Africa CDC, that is going to look at concrete implementation of that call to action by our heads of states. They also requested Africa CDC to put in place a training program for public health emergency operations centers so that Africa can be able to build its capacity in this area. This is almost a record that within 50 days of a call to action being made by our heads of states, the ministers of health have come together to begin the process of implementation. Truly, our ministers do understand the emergency nature in which we work, and therefore the need for speed of implementing decisions, and we applaud them for that. The second announcement that I will have is that next week, during the high-level debates period for the UN General Assembly, Africa CDC will be having 3 side events. The first one on Sunday the 18th at the Africa Center is going to focus on sharing what Africa CDC as an institution is with our partners, and also providing details of what we are doing and where we are going in terms of our vision, and of course, looking forward to their support. That is on the 18th of September, that is this Sunday, in New York at the Africa Center. The second side event in the margins of the UN General Assembly is going to be on the 19th, 19 of September, and that is on Monday. It is in the afternoon from 3 to 5 p.m. Again, this is going to be held in the margins of the UN General Assembly, and the location is our offices, the African Union mission to the UN. We have offices where we'll be hosting this particular side event, and it will focus on workforce for public health, and we expect the presence of our heads of states to grace that particular event. On the 21st of September, and that will be on Wednesday, we will have the third side event from 11 in the morning until 1 o'clock, again at our offices in New York. And this particular event will focus on the new public health order. And again, we expect that it will be graced by some of our heads of states who will be attending the UN General Assembly. So these, Wayne, are the updates that I had for our colleagues today, and looking forward to the questions.
Thank you very much, Ahmed, for that comprehensive breakdown of the situation on the continent, including also the mention that we've made of rabies, which I think is a new topic for us to discuss on this program. Now let's go into our question and answers section. But before we do that, let me just give you that WhatsApp number that we're using today. And as I've mentioned, this is a new one. It's different from the one that we normally use. So today's WhatsApp number is +251 93 569 2609. +251 93 569 2609. So our first questions have come through on the question and answer section, and they are both from Alexander Winning. Thank you, Alex. So the first one that I want to put to Dr. Omar is, Alex says, I would like to ask Dr. Ogwell Omar whether he agrees with comments by Dr. Tedros yesterday that the end is in sight. And this was in reference to the COVID-19 pandemic. So the question then is that the case for Africa, or is there still a significant threat to the continent from the virus? So let's take that one first, then we'll come back to the second one.
Yeah, thank you. Thank you, Alex, for that question. Indeed, the situation of the pandemic continues to evolve, and different parts of the world are experiencing it from very different perspectives. Here on the continent of Africa, with just over 22% of our population being fully vaccinated, it means that the levels of protection are still relatively low, and we intend to continue to push for even higher rates of vaccination across the continent. The virus is still circulating, and with the low rates of vaccination, the pandemic is still very much with us here on the continent. So although the end may look like is not too far, we are still in that mode where we consider it a pandemic, we consider it an emergency, and we are planning, preparing, and responding to the situation on the ground in that fashion, that it is still here with us, and it is still an emergency that we need to address as effectively as possible, particularly because of the low vaccination rate. The pandemic is still here with us on the continent.
All right, so the second question from Alex, which by the looks of it is our final question for today, unless we receive any more questions after this. But Alex says she would also like to ask, are there any plans to get new COVID-19 vaccines that target Omicron to the African continent? Or is getting vaccines for monkeypox now a bigger priority for Africa?
No, thank you. Thank you, Alex. At this moment, our focus is on getting as many of our citizens to be vaccinated, fully vaccinated, as many to be fully vaccinated as possible. We are not yet looking at targeted vaccines that target different variants. We just want as many of the African population as possible to be fully vaccinated. We are having the monkeypox outbreak simultaneously. Indeed, we are having measles outbreaks, we are having cholera outbreaks, and others, as I've shared. So all those that are vaccine amenable are a priority, all of them, including COVID. And we do not treat one to be more urgent or more prioritized than the other. All are emergencies, and we are dealing with all of them at the same time. We will still seek more vaccines for COVID. We will still seek vaccines for monkeypox, and we will still seek more vaccines for measles, for cholera, yellow fever, and all the other outbreaks that are vaccines amenable.
Cara Anna from Associated Press says, thank you for the briefing. Could you speak in detail about why monkeypox vaccines still haven't arrived? And what are the partners telling you about this delay?
No, thank you, Cara Anna. Monkeypox vaccines have not arrived on the continent of Africa for two main reasons. One is that although we are willing to purchase, we do not yet have any doses available to be bought. And those doses that have been bought, and this is the second reason, are not yet accessible to Africa, either because those who have bought them have not received, or those who have received are not at the moment able to share their doses with us here in Africa. As for those that we are engaged with in discussions, we have not yet received positive feedback, and we continue to negotiate and clarify how these doses will be used if they arrived on the continent. This is, I cannot be able to give you a timeline, so we continue to engage with those who have access to monkeypox vaccines, and we remain hopeful that Africa will see some of these vaccines soon rather than later. Thank you.
It's time for us to say hello to Esther Nakazi, who is a journalist based in Uganda. And Esther says, according to the multi-country research on antimicrobial resistance in Africa report, researchers have found that most laboratories across Africa are not ready for AAT in 8 of the 14 countries. More than half of the population is out of reach of any bacteriology laboratories. What are Dr. Omar's reactions to these findings?
No, thank you, Esther. I'm glad that you're very current. We are today and tomorrow hosting African countries and our partners here in Addis Ababa to disseminate a report that has come from research in 14 countries on antimicrobial resistance. And some of the results are quite, are giving us quite a challenge in terms of the way forward to resolve them. Now, that report is a retrospective study of the situation of antimicrobial resistance in those 14 African countries. We have put in place mechanisms to support those countries to do prospective data collection so that we have more current data and therefore a more current picture on the situation of antimicrobial resistance here on the continent. The results of the study in the 14 countries is giving us two very clear messages. One is that we need to improve surveillance for antimicrobial resistance in humans, in animals, and the environment so that we are more prepared in terms of policy response and action at the facility level. We need to do that. So this is one very clear lesson it's giving us about the need for us to continue doing this very prospectively. The second very clear message that the research is giving us is that we do not yet have enough laboratories that are handling testing for antimicrobial resistance. We do not yet have enough capacity in terms of human resources at the lab level and at the clinical level to collect information regularly for us to be able to track antimicrobial resistance here on the continent. What the team are doing during this workshop, dissemination workshop, is they are going to come up with recommendations of concrete things that we as Africa CDC, the Africa Union, partners, and our member states can be able to do to reverse this particular worrying trend across the continent. So I will defer answering that directly until after we hear recommendations from the workshop, because we have pulled all these experts together. That way they can be able to give us their very well thought through recommendations of what we need to do going forward. But what is clear for us is the capacity is low, and we must improve the capacity in the lab and the capacity in the clinical setup so that we have much less antimicrobial resistance being reported than what we have currently. It's a bit too high for comfort. Thank you.
All right, thank you. I don't see any questions, but just in case someone is still formulating their question, you could perhaps update us if there's any quantified data now that speaks to the impact that COVID-19 has had on the African continent, economically and socially.
Thank you, Wayne. So there are several studies that are ongoing to give us much better a picture of three things. One is effect on public health, the health sector in general. There are those studies that are going on across the continent. Preliminary information shows us that the routine work that we do, whether it is malaria, TB, HIV, childhood illnesses, those routine services suffered as a result of the COVID pandemic, and now it is being quantified to see just how bad the suffering was. Second is on the economic front, and our counterparts in the economy and trade are also compiling a report to come up with what effect it had on the continent in terms of economic activities. And we are hoping that will also be able to come through soon. But preliminary results show that there were huge losses for the African economy, and we are waiting to see what those details would be. The third and final one is effect on society in the way that we live. Being locked up for days and months, lockdowns were not very interesting, and they had a lot of mental health issues going on, and that affected the way that society was relating. And data is also being collected to see just how much of a burden the COVID-19 pandemic was, particularly during the period of the lockdowns, and how that affected our families and our societies, and in which way. So we are waiting for that data to come out, but preliminary results already show that, for example, gender-based violence increased. Although countries are trying to do that, it has not been very easy. So this data is coming through preliminarily, but we await concrete reports from the relevant organizations so that we can actually be able to synthesize that and hopefully share that with you in the coming weeks.
Thank you very much, Ahmed, for that response. I see that we still don't have any more questions, so I think that we are done for today, but perhaps, oh, wow, okay. Just as I was concluding, we have a question that has come through from Esther Nakazi. And Esther says, some countries are reporting increased measles cases, as you rightly gave us the data. There are reports of religious objectors. What should be done about this? And should we have some policies in place to stop this trend?
Thank you very much, Esther. The driver of this current measles outbreaks in several countries, the drivers are many. But yes, in some countries, religious beliefs have actually played a role in some communities where measles has grown quite fast. We as Africa CDC are encouraging the governments of the communities concerned to engage them so that there is understanding of the risk that unattended measles outbreaks pose to the general public, including those communities themselves. This engagement usually results in better understanding of what the individual role is and what institutional roles are, like religious institutions, and this we leave to the member states to be able to handle. All countries on the continent have legal frameworks that can be able to handle this. They have policy frameworks that can be able to handle this, and we trust that they're actually doing that. I'm just from Zambia for a meeting, the meeting I referred to in Livingston, and this was part of the discussion. The ministers were concerned that some religious beliefs were actually hampering their efforts to contain some of these outbreaks. But they assured us that they had frameworks and the legal mechanisms in place that will be able to handle this in a humane way and in a manner that would not result in a negative reaction from the affected communities, because you don't want to do that. But legal frameworks and policy frameworks at country level are adequate to be able to handle objectors, whether it is religion or otherwise, at country level.
Judith Akolo has come through and she says, today I have a problem with the internet connection and hence I'm unable to follow effectively or even ask questions. Well, we're sorry about to hear that, Judith, but please do check on the WhatsApp group, because colleagues normally send out the original Zoom file that you can open and have access to. You could also play back on the Africa CDC YouTube channel and also on the Africa CDC website. So that information, this whole briefing would be available there. So I hope that will be of assistance, but thank you very much for coming through to us. All right, I think we are done with all the comments and questions from today. So it's back to you, Dr. Ogwell, for your final highlight points for today.
No, thank you. Thank you, Wayne. And 3 points to highlight. The first is that the continent is experiencing many outbreaks at the same time. In fact, we have 17 on the continent. The rest are smaller. I've only shared 7, which have a much higher risk. So there are multiple outbreaks that we are dealing with on the continent. And this is a reflection of the complexities of not only Africa, but also of us engaging with the pathogens that cause disease. So there are multiple outbreaks and we are handling all of them the best that we can. Second is that COVID is still here with us. And one of the really good ways of ensuring that we protect the population effectively is vaccination. And so as we roll out our vaccination campaigns across the continent, we are now in about 14 countries and we are going to increase that every week. We are urging members of the public to go out and get vaccinated. And those who are eligible, please get your booster doses so that you remain protected from COVID-19. The campaigns continue. COVID is still here with us, and we are asking members of the public to get vaccinated. The final is UNGA next year, the UN General Assembly, the side events. We will be sharing on the platform for journalists to be able to be aware of the details of where we will be. And we ask you to participate actively, those who will be in UNGA and those who can be able to join virtually. There will be opportunity for that as well, so that you can participate effectively in all the 3 side events that we will be organizing in UNGA on Sunday, on Monday, and on Sunday, on Monday, and on Wednesday. So we really look forward to engaging with you beyond this press briefing at the UNGA events next week. I thank you very much and have a very good week.
Thank you very much, Ahmed. That was Dr. Ahmed Ogwell, who is the Acting Director of the Africa Centers for Disease Control and Prevention. Colleagues, thank you very much for having been with us and for your continued interest in discussing the issues of public health on the African continent. Thank you to colleagues behind the scenes, from our interpreter, to colleagues from the Africa CDC and from the African Union for bringing this broadcast to us. From me, let's meet again next week on Thursday at the same time. Bye-bye for now.